Hi, everyone, and welcome to today's webinar on mastering multi-location healthcare success with online reviews. As healthcare organizations expand across multiple locations, managing patient reviews effectively becomes more important than ever. The feedback your patients leave online not only shapes your reputation, but also influences patient acquisition, retention, and long-term growth. Whether you're already managing reviews across several clinics or just starting out, understanding how to streamline this process is key to scaling your practice while maintaining trust and care quality. So today, we'll walk you through what multi-location review management is, why it matters, the challenges with manual handling, how technology can support you, and real examples of how others have succeeded. We'll also cover best practices you can apply right away to ensure every location reflects the same level of care and professionalism. But before we do dive in, just a quick note, I will be answering questions at the end of the presentation. So feel free to submit them anytime using the Q&A option. Even if you do need to leave early, just send your questions in and we'll make sure that someone does follow up with answers after the webinar. But with that out of the way, let's get started. For those of you that I haven't met yet, my name is Oliver Blanco, and I'm excited to be your speaker today. As a digital marketing and account manager here at Repugen, I get to work closely with healthcare providers and practices, helping them just improve their online reviews and build stronger relationships with their patients. What I enjoy most about these sessions is the opportunity to learn from you, whether you're already part of the Repugen family or just exploring what we offer. I'm looking forward to hearing your experiences, answering your questions, and discovering how we can better support your practice's growth and patient engagement. And so, as just a quick agenda, here's what we'll be covering today again. First, we'll start by understanding what multi-location review management means for healthcare practices and why it's so crucial as you grow. Then next, we will be taking a look at why reviews matter across all of your locations, how they influence patient trust, engagement, and overall reputation for you. Then we'll walk through how reviews are typically managed manually and the common challenges and risks that come with handling them at a scale. After that, we'll explore how technology can support you in scaling review management efficiently while maintaining consistency and quality across all locations. And then finally, again, at the end, we'll open it up for questions and have an interactive Q&A session. But hopefully by the end, you'll have actionable insights to better manage reviews and support your practice's growth. So now let's actually start. And to start, let's actually ask the question, what exactly do we mean by multi-location review management? And it's honestly pretty simple. It's about keeping track of patient reviews across all of your locations, whether you run clinics, hospitals, or care centers. And it's not just one place where reviews show up. Patients share feedback on Google, Facebook, Yelp, you name it. So you just need to be monitoring all of these different channels. But it's not just about responding to every review. It's about paying attention, spotting patterns, and learning from what patients are saying. Maybe you find a few of your locations have the same issue. That's a sign for you to take action. And then at the end of the day, if you want to grow your practice without compromising the patient experience, having a system in place to manage reviews consistently across all of your locations is an absolute must. And so when looking at reviews, reviews are more than just ratings and comments. They directly impact how patients trust your care, how they refer you to others, and how they view the quality of your services. Every location in your network contributes to your overall reputation, and that's why it's so important to manage feedback thoughtfully and consistently across all of your clinics and care centers. And in fact, one of our own survey researches that we've done excuse me, earlier this year found that 73% of patients take reviews into account when selecting a healthcare provider. That's nearly 3 out of 4 patients. And so, whether they're searching for a primary care doctor, dentist, urgent care, any kind of healthcare specialist, reviews are shaping those patients' decisions. And then it gets even more critical. According to Bright Local's report, 63% of consumers say that they would lose trust in a business after seeing mostly negative reviews. One unresolved negative review at a single location can damage your entire brand. Reviews influence patient trust, referrals, and even how you rank in local search results. That's why a consistent and proactive approach to review management is essential for every location that you operate in. So now that we've talked about why reviews are so important, I'd love to hear from you. How actively does your healthcare organization manage reviews across your locations? You'll see a few options on the screen, such as we don't actively monitor reviews. Uh, we have a centralized system in place. We use some tools, but it's inconsistent. And then we manage reviews manually for each location. Take a moment to select the option that best describes your organization. This will help us understand where you are in your review management journey and tailor the rest of the session to your needs. All right, so just going to be moving on. Uh, So next is regarding how to manually manage reviews for multiple locations. So for some healthcare practices, especially those that are growing or just getting started, managing reviews manually across locations is how they begin. It's a hands-on way to stay connected with patients and ensure their feedback is heard. So we'll walk through some key steps involved in manually monitoring uh, and responding to reviews. These are simple yet important actions that help you stay engaged with your patients, even if you don't have dedicated tools in place. And so the first step is claiming and verifying your profiles for each location. This ensures patients can find you easily and leave feedback. Now, this process can get a little detailed, so we won't dive into it right now, but don't worry. If you want, we can send you a step-by-step guide on how to claim your profiles on every major review site out there. But once that's set up, monitoring feedback daily helps you stay on top of patient experiences and reviews. Responding quickly and personally shows that you care while keeping a consistent tone across locations makes your practice feel reliable and professional. While making your response personal is important, it's even more crucial to maintain HIPAA compliance. So ensure that even if a patient discloses protected health information, you never include it or share it in your response to them. Tracking insights and reporting fake reviews also helps you protect your reputation and act on feedback that really matters. And then together, all of these actions create the foundation for a consistent, trustworthy reputation that supports growth at every location. And then next, as your practice grows and adds more locations, managing reviews manually can start to feel overwhelming. What seemed manageable with one or two locations quickly becomes harder to track and respond to efficiently. So let's take a look at some of the common challenges and risks that rise when you try to handle reviews this way. Understanding these will help you plan for the long-term growth and ensure your team stays connected with your patients. And so, with more locations and platforms to monitor, the workload grows, and it's harder to respond quickly or keep your messaging aligned. Inconsistent responses across locations can confuse patients, and tracking feedback manually can be time-consuming, leading to just missed chances to engage. And then the risks just go beyond just inconvenience. If feedback isn't addressed in time, it can hurt trust with your patients. So poorly handled complaints might spread negative impressions, and mishandling patient data could raise compliance concerns. So ultimately, it's all about how missed or poorly managed reviews can reduce patient engagement and loyalty, impacting your practice's reputation and growth. So now that we've seen the challenges and risks, uh, I'd like to hear from you again. So what's the biggest challenge you face when managing reviews across multiple locations? Is it responding to negative reviews quickly, or perhaps the time it takes to track feedback manually? Maybe it's monitoring across different platforms or keeping responses consistent across your locations. So another poll will be popping up in a little bit. Just please select the option that resonates most with your experience, and then this will help us understand where you need the support the most and guide the next part of our discussion as well. All right, so just moving on now, let's shift gears and talk about how technology transforms review management when you're working with multiple locations. The truth is, manual methods can only take you so far. Technology allows you to move from reactive and scattered efforts to proactive, scalable systems that keep your entire network aligned. So with the right tools, healthcare organizations can centralize review management into a single dashboard, bringing all platforms and all locations into one view. Technology also enables automated alerts and even AI-powered responses, helping staff reply faster and more consistently. You also gain real-time insights so you can track trends and spot areas for improvement immediately. And then best of all, technology reduces the effort needed to keep communication consistent across your entire network, making review management scalable as your healthcare group grows. And then just to throw us in, this is exactly where Repugen comes into play. With our all-in-one dashboard, you can see reviews across every location in one place. Smart alerts and AI responses make responding to patients faster and easier, while real-time insights help you spot trends and improve care instantly. Consistency is built in, so your brand voice is the same across your clinics. And as you grow, Repugen scales with you, ensuring that adding new locations doesn't add new stress. So, in short, one platform manages all of your multi-location review needs. And then sometimes the best way to understand the impact of structured review management is to see it in action. Here's a real-world example of a healthcare group that moved from fragmented review processes to a centralized technology-driven approach with Repugen, and that is Memorial Care Medical Group. It is a large network of clinics, like many multi-location practices. And in the beginning, they were juggling reviews from different sites with limited tools and scattered processes. So that's why they ended up turning to Repugen. With that centralized dashboard, they brought all reviews under one roof, making it easier for their staff to monitor and respond. And so the result of that, automated review requests and alerts took a huge load off of their team's shoulders. And honestly, total reviews and feedback increased by nearly 250%. Patient satisfaction jumped up to nearly 26%. Negative sentiments dropped from 27% to 8.3%. Uh, and then complaint resolution time was cut in half, making patients feel heard and cared for like never before. This case just shows that when review management is structured and supported by technology, it's not just about handling feedback, it's about building trust, boosting patient experience, and running a smoother, more effective operation. Now, let's quickly look at some of the best practices that healthcare groups can use when managing reviews across multiple locations. First off is to centralize monitoring with technology so you can, always know what's happening across different platforms and you're not taken by surprise. Automate repetitive tasks like review requests to save your team time. Make it easy for patients to leave reviews, whether it's through QR codes, email links, or just general follow-ups with them. Use consistent response templates that reflect your brand's voice while still sounding personal. Address feedback quickly with empathy and professionalism, no matter which clinic it comes from. And then, most importantly, protect PHI by staying HIPAA compliant in all of your responses to your reviews. And now let's wrap this up with some key insights you can take back to your team today. Managing reviews across multiple locations doesn't have to be so chaotic or exhausting when you have the right systems in place. So some of those key takeaways again were just having a structured review process. Uh, that isn't just a task, it's the backbone of building patient trust and growing your network. Trying to manage everything manually slows you down and leaves gaps that can hurt your reputation and patient experience. So, smart technology helps you fix that. It helps you stay on top effortlessly. Central dashboards, automated alerts, and AI-powered responses give you the power to act fast and stay consistent. Then your patient reviews hold more powerful insights. Use that data to spot trends, solve issues, and continuously improve care across locations. And then just best practices help scale while staying personal. And then with these strategies, you can confidently scale your healthcare practice while ensuring every patient interaction feels thoughtful, timely, and trustworthy. Now, with that out of the way, I will open it up to some Q&A. All right, so we got one question. This person had asked, we manage reviews manually across our clinics. What's the real risk if we don't centralize? And that real risk is that manual management creates blind spots. As I mentioned in the webinar, it highlighted that missed reviews can damage your reputation or overwhelm your staff and just lead to inconsistent patient experiences. So without a centralized system, there's a risk of missing those patterns in feedback, like those recurring complaints and losing the ability to respond quickly and professionally across all locations. So that's why we strongly stress to, develop a centralized process so that you can avoid having those blind spots and address things as consistently and as easily as possible. All right, we got another question. This person asked, a lot of my patients include PHI in their review. How can I respond without violating HIPAA? And so that's a very good question. And the best thing to say is that you never want to repeat or acknowledge PHI in your response. Instead, you'll want to direct the conversation by thanking the person for their feedback and then encourage them to contact your office directly uh, to address whatever that concern is. This shows that you are trying to reach out to them, try to build that connection without exposing any sensitive information. So kind of put it on their plate to contact you so that you can discuss in more detail. All right, we got another question. One of our locations in my network uh, gets more negative reviews than the rest. What should I do? And so that's honestly a signal for action. Review the data or review data helps identify trends so you can uncover root causes. So like say, for example, there's some issues with staffing or wait times or just communication issues. You'll want to see what those trends are with that specific network and then make actionable steps to address those. So whether it is wait times, what can you do to address those wait times? Maybe make processes a little bit more smoother, or if it's some communication issues, maybe do some training when between staff and patients. But either way, figure out what that actual trend is like, and then create those processes to address those trends. Right. Another question already is what should we do if we get a review that's clearly fake or malicious? And so for those cases, you'll want to document it and report it to the review platform. So most sites, like say it was posted on Google or Yelp, you'll be able to flag that review that violates those guidelines just by clicking the three dots on that review and then reporting it. Or you can use something like a review management system that can help track and escalate these a little bit more efficiently as well. All right, and I guess the last question for today, can managing my reviews actually help improve patient care at my clinic, or is it just about improving my practice's online reputation? That's a good question, and the answer is both. Reviews reveal patterns in patient experiences, highlighting what's working and where improvements are needed, and then acting on those insights improves your overall care, boosts satisfaction, and strengthens trust, patient trust over time. So those were going to be all of the questions that I will be answering for today. So if there are any more, feel free to submit them or send us an email and we'll be happy to address them. But now I just want to cover what comes next. So managing multiple locations manually can be time consuming again and overwhelming, but honestly for you, it doesn't have to be. So here's what you can do to take the next steps with us. First, book a one-on-one walkthrough of our platform. In this session, one of our team members will show you exactly how it can simplify managing multiple locations, thus saving you time and effort. Next, you'll want to use RepuTally to get a clear picture of where your multiple location practices currently stand when it comes to their online reputation. It'll highlight opportunities to improve your patient satisfaction and, again, your online reputation across all of the major healthcare online review sites out there. And then finally, we honestly invite you to try out our Review Pulse plan free for 3 months. Experience firsthand how it helps multi-location practices like yours monitor and enhance patient feedback seamlessly. So overall, these next steps are designed to give you actionable ways to get the process started so that you can improve all of your multi-location management needs. And now that is it for the presentation today. So thank you so much for attending. Your time and feedback is just what makes these sessions super valuable for me and for the rest of our team. So we'll send you a recording of today's session and the resources that we discussed so you can review them and share them with your team as well. We're looking forward to seeing what you do next and to build the future of patient feedback together. So thanks again and have a great rest of your day.